It is Medication Monday, and I want to talk about medical marijuana.
Okay.
Is it legal in all 50 states?
Medical marijuana, I believe, is not legal in all 50 states. It is in Louisiana, and it's legalized for recreational use, I believe, in California, maybe Michigan, Massachusetts, Colorado, to name a few.
Okay. And what conditions is it used to treat?
Yeah, it's interesting. It's used to treat all kinds of things, from headache to pain to insomnia to anxiety. And in my role, I don't prescribe it, and there's usually a doctor that only prescribes marijuana. So you go to a medical marijuana doctor in Louisiana. A lot of times it's online. They ask you a few questions, and if you meet criteria, they'll prescribe it. So oftentimes patients will tell me that they're going to get a prescription, but it's my sense that the doctor prescribing it doesn't know the nuances of their psychiatric case. And I'll often tell patients, like, listen, there are other ways to treat your insomnia or your anxiety that may not make you as foggy. It's usually a better medical marijuana. It's a better treatment when patients can't tolerate the typical medications that we use. And then sometimes I'll think it's a good idea for folks to take it, namely because if it treats pain or anxiety, um, then it's a good third or fourth choice of medication instead of taking opioid medications like Percocet or oxycodone, because some folks just can't tolerate it, or they develop tolerance where they don't work as well after a time. There's also a higher risk of respiratory suppression with opiates. So medical marijuana is a good option for some people.
Okay. And how is it consumed? Is there various ways you can do that?
Yeah, I believe there's two main ways. I think is by smoking like a marijuana cigarette,
Mhm.
or doing an edible, which is usually like in a little chocolate or in a like a gummy. And I think there's probably a wide variety of different products that people use. They may also use like a vaporizer where you're not getting as much of the bad stuff in the marijuana plant, but you're just consuming more of the THC, which is the active ingredient in the plant.
Okay, got it. So if I was prescribed this and I'm about to consume it in whatever way, how do I prepare myself?
You mean prepare
Like,
yourself how?
so, do I need to be alone in a room, like not working, just kind of
Oh,
relaxing, that kind of thing?
I don't know the answer to that because I don't prescribe it,
Okay.
so I can't give a very educated guess about that, or answer rather. Um, I have patients who take it like multiple times a day, like two or three times. They take a little bit. Um, and I have other patients that only use it at nighttime to help relieve muscle tension or stress, and to help like relax before sleeping. So it depends on like whether you're taking one or the other. There's also different strains of medical marijuana. So the sativa is different, that strain, versus the indica. I believe indica tends to be more calming, and sativa may be more kind of an upper, maybe more stimulating for folks. And then patients may have a unique response to either of those. So it depends on what you're trying to achieve in terms of symptom relief, and it depends upon how you react to a specific strain of medical marijuana.
Okay.
For example, if it made one tired or foggy, you wouldn't want to use that before getting in a vehicle and driving around, you know?
Okay, got it. Those are my questions for you. So
Okay, very good. Great. See you next time.
see you next time.